Our guest is Ashley Orndorff. Ashley is the Executive Director of the Down Syndrome Network of West Virginia. Welcome, Ashley.
Thank you. Thank you for having me.
It's a pleasure having you with us. Ashley, what is Down syndrome?
Down syndrome is the most commonly occurring genetic condition in babies and newborns that occurs when there is an extra copy of the 21st chromosome.
Okay, now we have about 23 normal chromosomes.
Yes.
And there's 2 pair in every cell in our body.
Yes.
One from the father, one from the mother.
Yes.
And so what you're saying is that sometimes there's an extra chromosome.
Yes.
But are there other forms of, or tell us about the different forms?
Sure. You typically have the 23 from mom, 23 from dad, you get 46 chromosomes. And when you have 47 chromosomes, you have Down syndrome if it's an extra 21st. So there's the trisomy, where there is a full extra copy of the 21st chromosome. So you would have 47. There is a translocation where part of one of the 21st chromosomes broke off. So you still only have 46 chromosomes, but that 21st broke off and attached somewhere else, usually number 14. So that counts and presents as the extra 21st chromosome. And so that's not as common. That occurs in about 3 to 4% of cases of Down syndrome. And then even less common is mosaic Down syndrome, where it's a trisomy, but not every cell in the body has that extra piece. So you have a certain percentage of your cells will have the extra chromosome in them.
Do we know why this happens?
We don't. It's completely random. They've been studying it. It occurs across all genders, nationalities, races, across the world. It occurs about the same.
What is the occurrence rate of Down syndrome?
Right now, there are worldwide, or in the United States, about 1 in 700 live births have Down syndrome. So if we do the ratio to West Virginia, we can expect about 24 babies per year with Down syndrome.
And there's probably then about a total of 200 or more per year in our state.
Sure, when you account for, there's 24 born each year, and then they
Right.
grow up, and so we have hundreds of families.
Okay, so what causes it?
It's completely random. There's when the cells are dividing in utero, there's a mishap with the division, and there's an extra chromosome in there. That translocation, where it counts for about 3 to 4% of cases, about an even smaller number of those cases, not all of them, can be hereditary. So usually the mother, sometimes the father, will be a carrier for that translocation.
What's the main component to cause this to happen?
Well, most people, as women increase in age, their risk of having a child with Down syndrome would increase. But most babies with Down syndrome are born to younger mothers simply because younger women have more babies.
So, Ashley, there is one component that seems to be involved with Down syndrome or the cause of it. What is
Sure.
that?
The only component that has been known as a factor to increase the risk of having a child with Down syndrome is maternal age. So as women age, they are more likely to have a child with Down syndrome. However, most babies with Down syndrome are born to younger mothers simply because younger women have more babies.
So if you have several babies, you might have one, particularly because if you have several, many of those will be, or some of them will be when you're older.
Sure.
So that's a factor.
Yes.
Okay, so we can't figure out something to prevent that. So can they tell when somebody's pregnant if they have Downs, and why would they check them for that?
Sure. There are many prenatal screens and tests to determine if a baby has Down syndrome. Those screens have a margin of error. The only 100% accurate test in utero would be an amniocentesis, which has its own risks. But they can test the baby for different markers. There's often markers on the baby's neck or in the heart, kidneys, brain. So knowing prenatally, if your baby has Down syndrome, would benefit you to, one, prepare yourself for what that means once baby comes and the things that come along with having a child with Down syndrome. The biggest concern is are there any heart defects?
Okay, so we know that in some countries there may be more, and also it can be transferred on. But if you do these tests and find out that you have these problems, what are your alternatives?
Well, we do know that statistically, most mothers who determine that their baby has Down syndrome in utero will seek a termination. That's what we try to do is provide support and education to families, because we know that having a child with a disability that is not going to go away is not something that most families would expect. And so providing support to these families and how to help their child grow and develop and learn is really our strongest goal.
But I believe that the abortion rate has decreased compared to what it was before. When a Down's diagnosis was made, I think it was more common to terminate it.
Yes.
Is that correct?
Yeah, it has gone down slightly in America with more education and services and resources available to families. You're really taking out that fear factor of fear of the unknown, and so more people are seeking support to learn how they can help their child.
So why did you become the executive director of the Down Syndrome Network to help so many people?
Sure. Well, when my daughter was born almost 10 years ago in January, she'll be 10, she had a birth diagnosis of Down syndrome. We had elected not to do any prenatal testing or screening. And so she came out and surprised us all. And I tell them I accidentally joined the board of the Down Syndrome Network because we went to a meeting to really seek support, and everyone was so welcoming. And I met other children, older children, who had Down syndrome, and they interacted with my daughter. And of course, all the other mothers tried to steal her, and it was very comforting and welcoming. And so from then, I just got more involved with anything that they were doing, and it provided a lot of support and helped us through the grieving process.
Do you mind if we show a picture of your daughter?
I don't.
Okay.
She'd love it.
There she is.
This is Hannah. She'll be 10 in January. She is, she's sassy. She's a spitfire.
Well, I'm going to say something, because when I went to your office and I saw her and her brother Daniel playing, I did not notice that she was a Down baby.
That she had Down syndrome.
Yes. So the reason was most of us in our lifetime, sooner or later, will see a Down baby or a person. And the distinguishing marks are usually very definitive. And so the symptoms can vary. We know that many times if you see some of these children all at a meeting, many times they look like they're in the same family.
Sure.
Yes.
Yes.
Because of the changes in the chromosomes.
Because of the changes in that chromosome, there are certain physical characteristics, the almond-shaped eyes, the smaller ears, the lower muscle tone.
Yes.
And so children and adults with Down syndrome will share those common characteristics. But most commonly, you would also see that they look like their families. So we have a saying that says we're more alike than different. And so most children with Down syndrome look like their families.
Yeah. That's very interesting, because the divorce rate in families who have a child that has Down syndrome is less than the average divorce rate.
It's less than the average rate of divorce among families who have a child with any other diagnosis.
And how do you explain that?
I have no idea.
Well, I think it has a lot to do with seeing the love involved. These children are usually no problem, basically. They're quiet, they're loving, And it makes one realize no matter what we have, sometimes other people have hardships. And the loving that I have seen in parents and patients that come in with Down syndrome that I've seen over the past 50 years, it's been amazing to see that. And when you see them as a family group, it's very obvious. And so I think these children and their siblings learn something about that.
Absolutely.
Love and compatibility.
There is a notion of siblings to a child with Down syndrome. We call them super sibs, and they have this connection, this compassion. Daniel has this compassion that a lot of other 5-year-olds don't have because he sees his sister and what she goes through and the
Exactly.
work that she puts in.
Exactly. Now, the other thing is they do have some learning problems.
Yes.
Some are more severe than others.
Sure.
So, as I understand it, if you start teaching some of these kids at an early age, like
Yes.
1 to 3 or 4 or 5,
Yes.
it makes a big difference.
Yes, we have a wonderful program in West Virginia called West Virginia Birth to 3, and we always encourage our families to get involved with those services. They provide resources to the families, but they can come in the home and do speech, physical, occupational, and developmental therapies to really promote learning, movement, communication. And the earlier, statistically, we know the earlier that children or anybody with any type of diagnosis gets intervention, the more successful the outcome.
Well, that's interesting because in past, it wasn't easy for these kids to advance.
No.
Now we see them particularly, I've noticed, in coffee shops or places where they serve people or even movie stars. We've seen a
Sure.
couple of movie stars. They've
Yeah.
done very well. So the intelligent, or that's different in every one, but if they are taught early, it
Yes.
can make a huge difference.
Well, and I think society as a whole has learned a lot in the last 10, 20 years to realize that people with Down syndrome don't need to be shut away and hidden and put in an institution. They have every value and worth that any other person has in society, and they can contribute, whatever that looks like.
And they can earn a wage.
They can. They can. We have, West Virginia has an ABLE program, which is a savings and checking accounts for individuals who receive Medicaid benefits and things like that, so that they can earn a living to support themselves, however that may be, whatever that looks like for each individual, and not lose their benefits.
Now, that's interesting because you mentioned Medicaid. They have some obvious problems. They may need glasses.
Yes.
They may need hearing aids.
Yes.
And these are now available to these children.
Absolutely. The American Academy of Pediatricians redid their healthcare supervision guidelines in the last couple of years to really look at different comorbidities that come along with Down syndrome. And of course, the biggest one, 50% of children with Down syndrome are going to be born with a congenital heart defect. So determining that early and providing intervention early is extremely successful. But we also know that there's a lot of vision and hearing problems. So getting children screened early for those types of things can help get them the resources that they need and then help them succeed in school and life.
Now, let's get back to the mother. When should she, if you're pregnant, when should the mother get an exam or go to a doctor?
Most of the prenatal screens will be offered, I think, between 12 and 20 weeks. They do an anatomy screen.
And why do they do the screenings?
The screening can detect certain abnormalities.
I'm sorry, the basic question is, why do they screen them? Is that because they've had a previous Down in the family or lost a Down from abortion or something? Why do women, or how do they know they need to be examined?
I believe the screening and testing is offered to all pregnant mothers. Most OB offices will offer a round of screens, and from those screens they can move forward if they see something, or if they see something on a scan. that may be a soft marker, as they call them, like a calcification on the heart or the kidneys or the brain.
Right.
But yes, if a mother has had a child with Down syndrome before, her risk will increase to have another child with Down syndrome.
So now, because of advances in Medicare, people are going to doctors earlier and they're getting these tests
Sure.
and checking the baby. And before, they didn't have this advantage. They had to know, the doctor had to figure out why, or there was a family history or some specific thing.
Usually advanced maternal age would
Okay.
trigger that, yeah.
And now, so they do it prophylactically.
Sure.
To see it. Okay, so that's good. We do have this available for them. Age is a factor, and having multiple children is a factor. But these people now, if they are pregnant for the 5th or 6th time, then they are automatically seen. I happen to know, I had one distant aunt who had 18 children.
Bless her.
One mother, one father, 11 girls and 7 boys.
Wow.
It was amazing. She was one, and Saida. Now, I happen to know one of my pastors has 15 in his family.
Wow.
So there are still large families. I think the average family now in the United States is 1.5 or something like it. So we're losing that. So this is important to know about. When they're checking the baby, they're looking specifically for heart problems,
Yes.
right? And some of those heart problems are correctable,
Sure.
they can tell, and some are not. So if they can figure this out, then that baby is referred immediately?
Most often, if there is a defect noted in an ultrasound, they'll be referred for either a fetal echo, which is something that families can get locally here in Charleston, or they'll be transferred out of state to, well, they could be transferred to a higher risk OB in our state, or they could be transferred out of state. We have several Down syndrome clinics in neighboring states that many of our families will go to get a closer look at the heart.
Is that necessary now with what we have at CMC and Thomas and West Virginia University? Are most of those not taken care of in this state?
Not necessarily. I think we've made a lot of advances in our state that can handle those types of issues here. It's just up to the individual physician of whether they feel comfortable moving forward with that or not. I know Ruby with their new children's hospital is doing a lot of corrective surgeries shortly after birth as well.
Well, we also run into, if I remember right, a lot of thyroid problems.
Yes, thyroid, hyperthyroid. There can be congenital hyperthyroidism. So children are screened most often yearly, unless there's an issue with their thyroid levels. They'll be screened more often, which it can be corrected with medication.
Now, the family has to know that these things are out there. I hope there are not many Down syndrome families out there that don't know this support is there for them.
We are reaching a lot more families.
How do you do that?
Social media, word of mouth. We did an informal survey recently, and most of our families are referred to our network through other families in our network, because they'll have a baby with Down syndrome and their sister will say, oh, well, so-and-so at my church has a child with Down syndrome, and then they'll reach out for some support and what to do. And we do some medical outreach as well with physicians and OBGYNs, and providing our information for when they do have a positive screen or test come back, they can refer that family for some additional support.
Now, are most of the family physicians and the obstetricians aware of what can be done for these kids or the Down syndrome network?
They are aware of the health supervision guidelines. Most of them are. That will trigger automatically in their systems usually. I know it does at our pediatrician of what she needs, what screens she needs done. But we are working to reach more clinicians, more physicians and providers to let them know that we are available. I recently attended the West Virginia Perinatal Summit and met several wonderful perinatal physicians who were interested in learning more about what our network does and how they can support their patients.
Ashley, let's talk about the lifespan of the
Yes.
average Down child.
Yes, it has increased drastically in my lifetime. I think the average lifespan right now is 70 to 72 years, and we are crediting that to more support, more resources, medical advances. You know, most of the heart defects can be corrected and managed. So children are living well into adulthood.
I can remember many of my patients over the years who were Down syndrome. We had to do different things, sometimes eye muscle surgery or cataracts. And I have asked parents over the years, do you have any special problems, or what are your aspects of Down syndrome? And to the parent, I've always heard, my child was a gift of God to me. They are always loving. They're usually not a problem. And my biggest concern is that if something happens to me, I don't know who will take care of my children.
Of course. Yep, that's echoed in my own family. That's echoed in many of our families. One of the things that we've done in the past is have conferences to make families aware of the resources available for planning for after their death. And we really try to get families to be proactive on making those decisions on, you know, anything could happen. You know, even if your children, you have young children, anything could
Or a
happen.
car
So,
accident, cancer,
sure,
yes.
having those plans in place soon. So if anybody needs help or to get pointed in those resources, to the direction of those resources, I encourage them to reach out to us so that we can let them know what's available in planning.
Are there people out there who know how to give them financial assistance, but also financial advice? Mm-hmm. Not everybody needs to have supplemental income. They may
Right.
have plenty of income, but how do they protect them in the future?
There are several, the ABLE program, like we talked about before, has several protections in place for the account holder, which would be the individual with Down syndrome. And then there's education on how to manage that, you know, in the event that you are taking over, you know, the authorized representative of that should a natural parent pass away or what have you. And then there's things like special needs trusts that lawyers can draw up to help with the planning, the financial planning, living arrangements, things like that.
So the big deal with the Down Syndrome Network and your work is to direct these people, the families that have this and don't know
Right.
that these facilities are available to them.
Yes. We connect families every day with different resources that are available to them for family planning, for, you know, for lifelong planning, the different resources that can help them now, different insurance benefits, things like that.
They even have a section on injuries and abuse programs.
Yes.
Is abuse among Down children unusual?
No. No. Unfortunately, when you have a vulnerable individual, they are at a much higher risk of being abused, neglected than anyone else because they can't say anything about it.
And that's particularly maybe at school,
School,
by other siblings,
sure.
maybe even by parents.
Yes.
Even normal children many times are abused. It's amazing what people will do to each other. So you have information on that at the network?
Yes. We have lots of different resources and information to provide for families and educate them. You know, children with Down syndrome do often have behavioral concerns that can be managed with the right education and resources to help that child, communicate their needs and their wants and learn appropriate reactions to things.
Do these children need special exercises?
Sometimes, yes, not special exercises, but educating families and children on living a healthy lifestyle is paramount, because we know that the risk of having some of these comorbidities like thyroid, diabetes, things like that will increase with an unhealthy lifestyle.
There's an increase in diabetes?
There's an increase in diabetes if you have certain characteristics. You're overweight, you have a poor diet, you don't exercise. So they're at risk for those things just like anybody else.
So then nutrition in these kids is important. Do they
Yes.
have special needs that they have?
Not necessarily. There is a prevalence, sometimes there's a higher prevalence of having, a gluten intolerance or celiac disease, but there's not really a special diet in general. Just making healthy choices, living a healthy lifestyle, and promoting that in the families.
Tell us about the West Virginia University Country Road.
Oh, this is exciting. So there are hundreds of programs across the country, that college programs, higher education programs for individuals with disabilities, not just Down syndrome. But WVU started the Country Roads program a few years ago, and they have, I think each year they accept 20-some students. And they have supports for these individuals to go to class, and they learn life skills and job skills and things like that. So it's really cool that my daughter has that opportunity to not only further her education if she wants to after high school, but do it at my alma mater.
They have over 260 programs, as I understand it. Now, you went to West Virginia University?
I did.
Ah, so did I for a long time. A long time ago. All right, now, your daughter is what, 11?
She'll be 10 in January.
10. At some point in the future, as a teenager, I started working in the first grade. She may want a job. What do you do if you want her, A, to try and get some special education, or B, let her start working?
Sure. She has a wonderful foundation right now with her IEP at school and her team at school to promote that future planning. But at a certain point, the Division of Rehab Services will get involved and help her to facilitate some of those job exploration programs. And right now her biggest thing is she wants to work at Chick-fil-A. So at a certain point, we can work with DRS to get her some on-the-job training wherever that may be. And she has her West Virginia ABLE account, so she can put her money that she earns into that and still receive her benefits. And so it's exciting. She really can do whatever she wants to do with supports and accommodations.
So she has a job. If she has a job and puts money in this special account, she doesn't have to pay taxes on that?
Well, it's not that she doesn't have to pay taxes. It's protected against the income limits for Medicaid benefits.
Oh, okay.
Yes.
Well, you obviously understand this problem, and I've seen you with your kids, and when I was there, I could not even tell she was a Down child. And the way she was interacting with her brother, she held her own very nice. I
She
want to
does.
thank you for taking time for your very busy schedule for being with us today. This is Dr. Richard C. Rashid, hoping you'll see a bright day.